Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
Today we're talking about blood flow restriction. What does it mean? Should you be training with it? And what are the parameters? Let's get into it. Now, before we dive into all the studies and details about blood flow restriction and what you need to be mindful of, don't forget that we have a ton of podcast episodes. But beyond that, I have just regular YouTubes where I go through mobility exercises or exercises for certain pain points. So don't forget to subscribe and leave a comment if you have something come to mind that you're like, I haven't heard a topic about this, or I'm questioning this, or I'm feeling this within my body. Let us know below so I know what videos to create for you.
Blood flow restriction training, and diving in a little bit more to what that is, when you should be potentially considering using it, how it was discovered. And I know that you got a kick out of the story of how the initial guy started looking into this and researching it.
Yeah, it originated in Japan by Dr. Yoshiaki Sato, and he actually came up with what is called Katsu training. And so what I thought was really funny is that his legs became numb after he was sitting at a Buddhist memorial in a kneeling position, and then he started to massage his calf, and he noticed the swelling and discomfort was similar to like when he was doing calf exercises. So he decided, okay, well, what happens if I then kind of restrict the blood flow and do low level exercise? Will I get the same kind of effect? And that's how he came up with, low intensity exercise. So you're looking at like about 20 to 50% of your 1 rep max. He had it include up to 200 millimeters mercury of the systolic blood pressure. And so it's kind of cool how this really originated and what his brain was kind of doing when he thought, oh my goodness, this feels similar to strength training.
I know, it's interesting. I feel like many people out there are like, oh, I sit in a certain position and then my legs get kind of numb or tingly. And then when I walk up, stand up and walk around, it feels a lot different. And it's interesting that he noticed this, massaged his calf, and is like, that kind of feels like exercise, and then basically decided to cut the circulation from his legs and experiment with this a bit. And it's interesting where he started out including 200 millimeters mercury. So like the systolic blood pressure is the higher one.
Yeah.
So normal or healthy is 120 over 80-ish. So 200 millimeters mercury essentially would, for most people, be occluding all blood flow into the legs. And that's different than what most parameters are that are used today, especially in the rehab space. But when he started and when other people started researching it, what they found was that essentially the body needs to work harder. You're not getting as much blood flow. You're not getting as much nutrients, oxygen, all the things that your muscles need to do exercise. So when you're doing a lot lower intensity exercise, your body's recruiting muscle fibers sooner. It's recruiting larger motor units, which essentially it's recruiting more muscle fibers to do the exercise that normally might be very low intensity. And they would also notice the body starts creating a lot more of what we would call these metabolites, or essentially the products that are created when you do exercise. It's the waste of the muscle.
So we get to see that this low load, blood flow restriction with resistance exercise really allows for the ability to train at a greater frequency with less mechanical stress on the joints, which allows for a broad application of post-operative injured and cardiac rehabilitation in patients, even in seasoned athletes and in the elderly individuals. And so I think that's what's really cool, is that you could still train just at a very low intensity, but still get this hypertrophy and strength gains happening within the body.
So what this could help with is people who are seeing a significant amount of sarcopenia or atrophy, muscle atrophy and wasting as they get older. It could be a way to go to your local blood flow restriction training center and do a couple sessions a week that will give you the similar results to as if you're heavy resistance training or Olympic training when you were younger, to combat some of that muscle wasting.
You pointed out something very specific that I think we have to include right away, is that you're going to professionals who work with this, who have there's certifications that you can get in this now, who understand what you're really measuring.
Because sometimes you see people just wrapping resistance bands around their arms and legs and doing
and
burpees.
Trying to do it themselves. Yeah.
Especially if you're somebody who has other comorbidities, has heart conditions. That's why it's so important, because a lot of we talked about Dr. Yoshiaki, who basically occluded all blood flow into the legs. Most protocols these days use a pressure that's above the diastolic blood pressure, which is the lower number. Like, so if it's 120 over 80, they're using a number that's more in like the 90 to 100 range. Mm-hmm. So it's still allowing some blood to get to the muscles, but not as much return or get out of the muscle. So it still creates that hypoxic environment. But that's why it's important, because how many people know what their blood pressure is at any given moment on any given day? You know, you're going with professionals who will measure your blood pressure, find the correct amount, and then monitor to see if you're showing any sort of adverse reactions as it's going on.
And using different cuffs, like for the upper extremity, obviously we're going to use a cuff that's different than the lower extremity because you have a much thicker and bigger shape that you need to
and blood pressure might be different in those areas.
In the lower body than the upper body. So, just working with someone and getting that understood is good. And what I think is also cool, what they've shown with the cardiovascular health in older patients is not only is it going to help with skeletal muscle and growth, but it's also going to help to reduce blood pressure. And that's what they were seeing. So combining resistance training, exercise in general, we know is going to help to reduce blood pressure. But now
that's something you see in like resistance training in general. You see a reduction in blood pressure. So it makes sense that you might see it here as well.
Well, and giving them the opportunity to be able to exercise in people that may not be doing as much. So overall, you're going to see a lot of those benefits.
So another area, we're seeing it a lot in the rehab space. I had a buddy who played in the NFL for 5, 6, 7 years, and he said blood flow restriction is one of the primary things that their training staffs use when they have somebody who's injured. Because again, say somebody tears their ACL and is in their rehab protocol. So they've had surgery, but something that you don't want to do is load the knee too significantly too early after you have that surgery, because the graft, the new ACL that they put in, is tender and is in a compromised position, so you don't want to start loading it heavily, or else that
you have to give it the time to heal.
Give it the time to heal. But they have found doing some of this blood flow restriction training is a great way to start getting that quad muscle on the front of your thigh working and firing well very early after surgery in a way that previously we weren't able to do safely or confidently.
Yeah, there's a lot of studies now coming out on ACL rehabilitation with using blood flow restriction, which I think is cool. And when we look at, just in general, if we're trying to stimulate muscle growth, some of the protocols that we looked at are pretty consistent with resistance training in general, right? You're not going to do it every single day. So they looked at, a combination with dynamic exercise. So they looked at doing it 2 to 3 times a week for over 3 weeks, intensity 1 to 2 times a day, repetition 75 reps overall. So they're looking at 30 reps, 15 reps, 15 reps, 15 reps. So 4 sets of that, 2 to 4 sets. Set pressure between 40 to 80% and restriction time 5 to 10 minutes of exercise with rest between 30 to 60 seconds. So pretty similar to what you would see, especially with like low load resistance training. Now you're just adding that blood flow restriction to it and seeing the results that helps to stimulate the muscle growth. So it's not something that you need to be doing every single day. I mean, this obviously depends too on where you're at. So say you are really early in your rehab journey and you're not doing a lot, you could afford to do a little bit more. But if you're actually just trying to stimulate muscle growth and you're just working with this, you're doing it just like you would with regular exercises, I think is a good way to look at it.
They've actually done studies with people in the intensive care unit or people who are even to the level of almost comatose where they are not moving at all.
Yeah, I think that's what's cool.
And one of the biggest risks in those populations is deconditioning significantly to the point where if you wake up or if you start trying to do exercise again, your body is so deconditioned that you can't do much, or you're in a pretty tough spot. And so they've done passive limb movement. So literally putting on the blood flow restriction cuffs and doing passive limb movement in patients that are in intensive care unit. And it was shown as an effective way to reduce the muscle wasting. They specifically were measuring the thigh muscle because easy muscle to kind of monitor and measure the size of in people in the intensive care unit. And that's an area in medicine that is hugely important because deconditioning during stays in the intensive care unit is huge problem.
There's a study on blood flow restriction and pain sensitivity, and I think this is a huge one for a lot of people. So when they were kind of looking at a ton of different studies and looking at, what they were really saying, higher pressure blood flow restriction results in greater exercise-induced analgesia, which is helping to, relieve your pain compared to lower pressure. And this is kind of the same if like exercising to failure, which produces a reduction in pain sensitivity with or without blood flow restriction. So they're saying essentially blood flow restriction, including low intensity exercise, can be an effective treatment to help reduce that pain threshold and really kind of introduce you back into movement. And I think that's what's really effective. Every podcast that we talk about, there's movement involved. There has to be movement in order to move you forward in getting you out of pain. So if this is helping you get to that point of being able to exercise and move, I think it could be a really cool practice to integrate with people who have really high pain.
There are studies done on osteoarthritis. There are studies done on patellofemoral pain that show this, that you can get a significant amount of pain reduction, in some cases even higher than the groups that are doing exercise, like the control group that's just doing normal exercise. Blood flow restriction groups will often see equal or greater pain relief. So again, a massive tool to help people start getting into movement when they otherwise might not be able to or might not be able to safely. But there are safety considerations, which we've already been kind of alluding to. There are definitely a lot of symptoms that you might, like adverse reactions or symptoms that you might start to experience, which is why the first thing, and we've said it already, this should be done supervised and in a way that's prescribed, especially since most of the studies we've been talking about have to do with people that are either injured in their early rehab recovery stages or people in the hospital, like on cardiac floors or people in intensive care units. So definitely should be something done that is under supervision.
It might not be an adverse effect, but even you might experience a lot of delayed onset muscle soreness or some bruising.
Yeah, you get the same soreness as if you're exercising very heavy.
And that could feel very alarming if you're not used to it. So again, working with someone who can help educate and talk you through what is happening and make sure you're not going beyond your threshold is so important.
And anytime we're talking about literally occluding blood flow, like if you're somebody who has blood pressure issues, if you're somebody who has different cardiac or heart issues, like that can be a big concern. And anytime we're occluding blood flow and then taking that pressure off and letting the blood flow and return back to the heart, there can be what are called syncopal events, or like you feel like you're going to faint. So a lot of things that lead us to say and lead the research to give recommendations that you should be doing this under supervision.
Maybe you are asking a physical therapy office, like, do you do blood flow restriction? I think it could be really beneficial. I'm having a lot of pain. I just want to get back to movement. And if that's something that you think, maybe you've been dealing with this for a long time, because they see it not only with, knee osteoarthritis, but also with patellofemoral syndrome. So if you're having a lot of knee pain, a lot of knee discomfort, you don't feel like you can load, you could do resistance training, you could put a lot of effort into your body, getting some supervision and getting, starting movement with blood flow restriction can be a great access point into starting to rebuild the muscle strength, confidence within your body, and get you moving a little bit more.
Thanks so much for listening in to another episode all about blood flow restriction training. What did you think? Did you hear anything that you liked? Have you tried blood flow restriction training, or did you feel like we missed anything? And please drop any other topics that you want us to do videos on below, and we will see you next time.